Hi, welcome to Ultrasound Physics. My name is Megan. I am the Assistant Academic Coach. Alright, so we're going to dive in. And I apologize because I'm recording myself on my phone, so this is not going to be very tech savvy. It's going to be a little bit of a journey, but bear with me. Hopefully I get you some important and helpful information to get started with studying physics. Alright, so I'm like this, it's inverted, isn't it? So we're going to flip this around. Alright, so I'm going to talk about our machines, our transducers, the different modalities, orientation, resolutions, and just a little bit kind of in general about sonography physics and instrumentation. That's SPI. This is our course. This is the board exam that you will be taking so that you can become a sonographer. It's called SPI, and I'm hounding that a little bit because we're not just learning about the physics of how ultrasound works, but we're learning about the instrumentation. So this course is relevant. This is what you will be doing. This is what you'll want to know so that you can do your job and do it well. What is the goal of ultrasound? What's the goal? What is our job? What is it that we are trying to do? With every single patient we scan, with every single image we take, we want to take diagnostic images. We want high resolution images. What is resolution? Are you a gamer, hopefully, maybe? Or do you know about TVs and poor resolution and high resolution, or good photographs that you found on the internet that have really high resolution? You can see all those details. Everything looks very crisp versus low resolution where it's kind of blurry and grainy and pixelated and you can't see the details and really see everything really well. Low res versus high res. Now, as you're learning about your machines and how they operate, you will be learning how to operate them yourself and how to get those good diagnostic images for your patients, for the radiologist to see if there's anything wrong going on inside that patient, right? So you're going to learn how to be a sonographer and how to use your machine. We're also going to learn about our machines to the level as though we were an engineer developing the technology of the machine. You might think it goes a little bit too far, like maybe you don't really need to know all that, but regardless if you need to know it or not, you need to know it because you'll be tested on it. But it does help you understand maybe why your machine is doing whatever it's doing or not doing what it is that you want it to do. Okay, so with that being said, I'm going to introduce you to some of the machines. I have really zoomed in. I'm going to zoom out. Okay, I have two machines out today. They are both GE machines, and they're both Logics. This one's a Logic E9. This one is a Logic E10, and doesn't say that it's a 10. I have both of these machines out for a reason. Mostly because these are the newer ones that you'll be using a lot in lab. But these are more advanced to such a degree that some of what you're going to learn and need to know how to use, you don't have to worry about when you operate this machine, which is awesome because it's just that technologically advanced. But it's not helpful for us in the class. So I also have this machine out. And back here, I have another machine that looks very, very, very different, and it functions very differently, and that's relevant to you and what you're learning, so I want to show this to you. Within our lab, bear with me, I'm going to walk over and show you. We also have these Philips machines. I believe they're Epic Elites. Yes, Epic Elite. Okay. These are another type of machine. Now, everything that you learn in physics is going to apply to every machine that you work on to some degree, even if you don't necessarily have to worry about changing a setting anymore on a more advanced machine. And you're going to need to know, likely, you're going to need to know different machines, because wherever you work, wherever you do clinicals, you will probably be scanning on multiple machines. Now, they do like to call the same function something different between brands, because, you know, capitalism. But these are your machines. Quick introduction. This console, now in ultrasound, your ergonomics and keeping your body safe while you're scanning is very important. The consoles move, okay? You can bring this all the way up if you want to stand and scan. You can bring the console down if you want to sit and scan, okay? You can bring it right to your appropriate height level. This button here will unlock the console. It's important that it's locked if you're going portable and you need to push the machine, otherwise you can have it unlocked. And then this one has like a power steering, so you want to keep that button pushed down while you adjust your console, and then you release it, and then it's going to kind of lock itself in place and hold still for you, which is awesome. But you don't want to just grab it and try to whip it around and overpower it, because you can break it. The other important thing is the foot pedals. Sometimes they look a little bit different. I just kind of play with them. One is like a locked steering, and will go forward and backwards and lock your wheels for you, so you can go portable and steer your machine without it going wonky all over the place. When they're both released like this, then you can move the machine side to side and adjust it, get it next to the bed, and then you can lock it so that it's held in place. So, you know, as you're pushing on it and moving things and guiding an interventional procedure, your machine doesn't roll away from you, right? Okay, so the console, the foot pedals. Now, I want to show, someone was at the door. Excuse me. Okay, I want to show you the different transducers that we use. Now, I scan general, I scan vascular, I do not scan echocardiography. So with that disclaimer, we obviously have lots of different types of transducers that we can scan with. You are going to learn all about all of them and what they do, okay? Very general overview. In fact, where's my, I don't have a transvaginal probe in here. You'll learn about it. But in general, a curved transducer is going to be lower frequency. It's going to have a wider footprint. It's going to be for deeper scanning, such as abdomen scanning, when you need to scan further into the body, okay? Your linears are going to be higher frequency transducers, and these are for more superficial scanning. This is a good one for scanning breasts, scrotum, thyroids, some vascular work. We often use the 9 for vascular scans. So if we're scanning legs, if we're scanning arms, and we're scanning arteries or veins, usually we're scanning with the 9. This is a 3D/4D probe. and I'll explain what that is in a little bit. And there's sector transducers. These are the ones that Echo uses more. These are really good for peeking through little spaces and peeking through like ribs. Okay. And then again up here, curved. This is a smaller footprint and it's a higher frequency than the larger curved. So like I said, higher frequency, you're going to be scanning more superficially. Smaller, it has a smaller footprint, so it's going to be a smaller area that it covers, so it's probably going to be a smaller thing that it's scanning. So this is really good for pediatric abdominal scanning and some really skinny, thin patients. All right, so those are the transducers on the machines. If you need to unplug and plug in a transducer, you can see the machine selections here. And I'm sorry for my reflection back there and all the lights reflecting that glare. I'm sure that it's going to impede the quality of the video that you're trying to watch. I apologize that this is not a high tech, but this is what we got. Here we go. Okay, so you just want to make sure that the transducer that you are removing is not loaded. I can see that the 9L is currently loaded on this machine because it's the one that's green and highlighted, okay? So if I want to remove the C9, I know that it's safe to do so. Come down here. Here are the transducer ports, and I want to take out the C9. So it's very easy to do. Just turn this, pull it out. Don't say I actually want this one in. Just line it up, push it in, turn the knob, lock it in. Super simple, right? All right, so now on the machines, this looks fairly overwhelming, right? But it's not. It's not that much, except it kind of is, kind of a lot. But we're gonna walk through some of the basics here. And then I'm going to give you resources, and I'm going to encourage you to learn more. In your scanning lab, you have manuals, you have quick starts, you have some information here that gives you tips and tricks and tidbits, okay? Some knobology, the knobs labeled, what each button is. They're pretty much labeled on the machine itself too. Kind of tell you what some of these things do, what's going to happen. Optimization, this is your physics. Telling you how to make your image optimized, how to make it better, right? How you use your focus, your frequency. You're not allowed to auto-optimize while you're in school. Speckle reduction, and then it tells you what it does, okay? This information is going to correlate with the information in your physics. All this stuff that you can do, you're going to learn about in your physics class. You could literally take this information and then next to it, and make a table, and next to it, you can discuss the physics principles that they're talking about, and you can quote your textbooks. And I know you can do this because I did it. We had a big assignment where we had to make posters, and we had to go through and say what pretty much every button did and how it correlates to the physics principles that we learned about, and quote the information, reference the information out of our textbooks. It was the most beneficial thing I think that I did in the entire program, aside from actually scanning. It was super duper helpful. I have that document. You can ask me questions. Ask your instructor if they're going to have you do something similar, because no cheating, but it's helpful, okay? So if you're allowed to have it, I'm happy to give it to you. You can ask me if you're not allowed to have it, but you have questions and I can help answer those questions with my document, I can do what I can, okay? All right. So if you're learning a physics concept and you're like, what the heck? I don't understand what this is talking about. Come play on the machine. Come poke at it. Find that concept in your machine, in the notes, and try it and see what happens, okay? All right, so we scan in different modalities. We have our B mode. This is our basic grayscale. We have color flow, which is a Doppler technology. It's a scanning modality. We have pulse wave, which is another Doppler technology. It does spectral. We have M mode, which is really good for motion. I'm going to demonstrate these for you as well. Now on the machine, you can select a transducer, and then you can select a preset. If you already have that transducer selected and you want a different preset, then you select the model. Sorry for that glare. And then these are the different subspecialties that we scan in. There's abdomen, OB, GYN, cardiovascular, urinary, small parts, and peds. This is vascular. Here's upper extremity arterial. So then it'll load the presets. And those are the basic settings, like we have our dynamic range is at 69, our frequency is at 8.4, we're using TIMP map D, and this is just set up under utility for scanning upper extremity arterial, okay? So you pick the transducer, you pick model, the subspecialties, and then the preset. If you're in the middle of a scan and you're going to switch to a different preset, but you want to save your field of view, you can retain field of view. I didn't realize that was there until like a month ago, so just know that's there. Okay, on this side, you can select patient information. Your instructor will go over how to get the patient information up, but the screen looks like this. And there's your scan. Reports will be your worksheet at the end. End exam, that's pretty self-explanatory. Utility will get you into changing things in the machine that you probably don't need to do or worry about. Definitely don't need to for this video, okay? So we're going to be in scanning. I have B mode, or basic grayscale. B mode, this is our options. We can page over, and we have more options. We also have things to adjust here, things we can do here. We can measure, we can change our annotations, lots of stuff, okay? Now, scanning. I'm gonna show you what these modalities do. The other type of scanning that we use, the other type of transducer that we use is that guy back there. He's in the back room. He's not my favorite. That's continuous wave. We do some Doppler, some segmentals is what they're called. You'll learn about them in vascular too. Okay, but we're going to scan. On our image, on our display, we can see, for some reason, I have an abdomen preset, but we can see the transducer that's selected. We can see the preset. I'm pretty sure I had done vascular, but somehow I switched it over. I don't know. Upper extremity arterial. Okay, switch that. This is showing us our TGCs. You'll learn about what those are and why we use them. This has a focal zone. This has 2 focal zones. Orientation. How do these transducers work? This transducer has cord that's all caught up. Hold on, I'm gonna get that down. Okay. Transducer has a notch. This notch corresponds to this part of the screen. Now, if you're doing vascular or general, these rules are going to apply. If you're doing echo, I don't know how you guys scan, I'm sorry. But regardless, the notch still aligns to the side of the screen. So this right here. You can invert this by pushing this button, but it's going to tell you where the notch is. Okay? Should be. Well, how it is. Okay. I'm going to set this down for a minute. So I'm going to go like this. I think it might be easiest if I scan my neck, actually. So now that I went through all that, I'm going to change my model to carotid. And I think before I start this part, I'm going to just stop this video so that it's a shorter video, and then I'll resume in the next video. Okay, we're resuming, and I'm showing orientations. In general, we scan with the notch either to patient's right or towards patient's head. If we scan the posterior aspect of the patient, we keep the notch to our thumb when we scan to the patient's left. What's important when we're scanning kidneys and we kind of go around the back of the patient, when we do vascular work, when we scan behind the knee, basically don't think about it too much, don't worry about it too much, just keep the notch to your thumb and just keep on scanning and your orientation will be fine, okay? In fact, if you ask a lot of people, a lot of it's not extremely relevant, but it's probably that's the way to do it. If you're scanning the posterior side of the back of a patient, like their chest and the upper ribs, kind of right below the shoulder blade, because you're looking for pleural effusion before doing a thoracentesis, you'll scan, again, notching your thumb, and you're just scanning the patients. They're sitting upright, facing away from you, and the notch is going to be to their left. That is standardized. There is not a standardization for breast imaging and notch orientation, and that can get confusing, but that's irrelevant. Okay. When you hold the transducer and when you scan, do not death grip the transducer. Okay. Students do this all the time. You're going to hurt yourself. Put your thumb on the notch. Hold it loosely, hold it comfortably. You're going to kind of figure out what works best for you. Just don't death grip it. Okay, try to relax your hand, relax your wrist as you scan. Okay, that aside, I have gel on my transducer. We need the gel as a coupling agent. You'll learn about that in physics, right? I'm going to get a towel. And I'm going to show you these different modalities here. All right. Let's find. Those resets are weird. Okay. Find my carotid. So this is B mode. Oh, let me back up. There we go. Hold on. I'm gonna get it. There we go. There's my carotid artery. Trying to scan through the phone. This is B mode. Bear with me while I set you down. I'm gonna put color on. Sorry. Wow, that's interesting. See you down into the machine. Turn on color flow. Turn on that button, scanning my carotid artery. Here's my jugular vein. Okay, now get the machine again. Now I'm going to turn on the pulse wave. This one is non-scanning. velocity information. So that's your B mode, your color flow, your pulse wave. Okay. The other one is an M mode, and I will show you that one. Usually we use that when we're scanning OBGYN. Echo might use it because we use it to scan the heart. And okay, just changing my settings here so that they're side by side. This is another non-scanned, okay? We're not building an image from left to right doing multiple scan lines. We have this one scan line down that's going to give us information across time about how the heart moves. And then we can measure the rate of that movement, the heart rate. We're not building a frame of a picture, we're building a graph. Okay, this is not going to be an image, this isn't a picture of what's inside the body. This M mode, it's the motion, it's just a graph across time of the little echoes, and as they change due to the movement of the heart, right? If a flap is moving in and out, it's going to be bright, dark, bright, dark, bright, dark, right? So I'll show you this here. Set you down again, sorry. I wish I had one more hand, you know? Alright, so here's a B mode image. This is going to be the M mode. There's the heart. And I'm going to update this here. Okay, so there was a little interlude there. But here's a B mode image of the heart, but the M mode is just tracing the movement of the heart over here. And then we could measure the heart rate between the cycles there. You see how it's just the echoes across time as they move, or as you can see, not really any movement up here or right here. We just have the bright echoes across time and the dark or no echoes across there. So that's your B mode, your color flow, your pulse wave, your M mode. Those are your modalities that you're scanning in, okay? The other thing that's very similar to the pulse wave but doesn't have a gate is continuous wave. So you have range ambiguity. Don't know how along that path you'll have that Doppler waveform, but it's going to look the same. I need to walk back to the gel. All right, so we do this for legs, and we'll come and try to see if I can find my post tib just along the medial malleolus here. And I'm gonna get gel on the sock. Now, I don't particularly like this because we're doing this blind. We're not looking. We don't get to see if we can find it. We're just listening. And it's muted. So volume up. Hold on. Setting you down. Sorry. Okay, I'm gonna have to unmute it with the remote here. Okay. Sounds like it's gonna be really loud. this is the transducer. It's just like a little pencil looking thing. And this is a weird position to be in. Instead of that, we're going to try a radial artery here. Just going to need more gel. This one requires a lot of gel. Apologize. Bear with me. It's loud. So what we get here is we get the waveform, and all we get is the morphology. We're not even recording velocities here. Okay, I fell off of it. There you go. No, no, and we're gone. It's supposed to be more sensitive, but we have that range ambiguity, and what we're getting here is the morphology of the waveform. The other thing that we can do with this system is we use pressure cuffs, and we take pressures of the arteries down the leg. So there's that little probe. All right. Now, the next thing that we're going to talk about is going to be resolutions, and I'm going to make that its own separate video here. So, see you again in a minute. All right, now we're going to talk about resolutions and our imaging. If I'm scanning a carotid and the notch is toward patient head, and it'll look something like this. Oh, sorry. There we go. Like that. I'm long to the carotid. The carotid looks long on the screen. So in the image, this side is patient's head. Notch side toward the patient head. This is toward my head. This way over here is toward my feet. This side is the same side that's coming right from the face of the transducer. Okay? This is always where the base of the transducer is touching, and then away. Superficial to deep, and we're typically scanning in general from anterior to posterior of the body. Okay? Now, if I turn this transducer to patient right, this will be a transverse cut. This is a transverse plane that will be transverse to that carotid. So then the image will make this. Notch orientations over here. Now I'm in a dual screen, so our indicator's up there on that side. But notch side's here. So this is patient's right, and then this is patient's left. Here's that carotid, and then a short axis to it. And again, right, it's still transducer face in a way. We're still going from superficial to deep. In fact, you watch my movement, that doesn't change. I'm long to the carotid, short, transverse to the carotid. But that transducer face, I'm literally turning in that same spot. It doesn't change. Okay? So, what does this mean for the dimensions, right? Because I'm looking at carotid artery that exists in 3 dimensions, right? What are the 3 dimensions? What are the 4 dimensions? Because there's 4 dimensions, right? We talk about 4D, that stands for 4 dimensions. So 3D, the 3 dimensions, are your length, width, and height, right? Think of a 3-dimensional shape. It has length, width, and height. The carotid artery, as it travels, it's got a length, it's got a width, and it's got a height. Okay, it exists in 3 planes. 4th dimension is time. Ultrasound is unique in that we can scan in real time. I can look at the blood flowing through that carotid artery and I can measure how fast it's traveling. I can look at a vein and I can see the valve as it flaps. You can scan babies in utero and scan a 4D and get a little clip of them doing flips because they like to move in there. So, how do these images correlate to those 3 dimensions? Where is our length, width, and height? Let's pretend like this is a carotid artery. We have length, we have width, we have height, right? So, the length of the carotid that I have imaged, right, it goes beyond these dimensions, but there's length. Now here's width, and here's height. Now remember, we're scanning the same way on this side as we are on this side, so the height here should be the same. This is still height. Okay, so we have length, we have width, we have height. How does that then correspond to our resolutions? What does resolve mean, right? Resolve means we can show 2 different structures exist in that area. Okay, we can resolve those 2 structures. We can show the existence of of structures. Okay, I resolved down here really nicely that tunica intima and media. Okay, you can see them really well. Up here it's more blurred, you can't really see it as well, it's not as well resolved. Those resolutions, the 3 resolutions, what are those? We have axial, we have lateral, we have elevational, right? These resolutions are also going to help us with our measurements and making sure our measurements are accurate. But 3D, spatial. 4D, we have the dimension of time. Temporal resolution. How fast our frame rate is, how fast that frame time, how quickly can our machine build that whole frame, how much time does it take to build that whole frame so we can actually see things in real time? Or is it starting to glitch out and we're lagging and things are slowed down and it looks blurry across time? So 3 dimensions are spatial resolutions. We have axial, we have lateral, we have elevational. Okay, so our axial resolution is from the transducer face and away. Right, this measurement on both planes correlates with our height. Lateral, side-by-side resolution going to correlate with our width. And on here, look, side by side, length. So that lateral resolution in those two planes correlates to our width and our length. Okay, but wait. If this has 2 dimensions and this is 1, then what is elevational? So we're scanning in 2 planes, 3 planes, right? but it's 2 planes at this time in this B mode modality, because that's a 2D image. Okay, and per each image, I'm showing only 2 dimensions. I'm showing length and height, or width and height. There is a dimension as I'm scanning that I am not showing, because I am showing what I could print on a piece of paper. I'm showing 2 dimensions right here in either one. But a third dimension exists. It's the dimension I'm not showing. It's the dimension that you can't see. It's the dimension that as I'm scanning is on either side of that slice image. And you can see these echoes in here. It's those echoes that I don't want. Okay? It's artifact. This is showing me the soft tissues that are on either side of my scan plane. Okay, it's like that dimension, as I was scanning, that would be on the other side, back here, on the other side of my monitor, or toward me. And that's what fills in these echoes, that fills in this clear cystic space that's not supposed to have these soft tissue echoes. That's that elevational resolution. Okay? Now this one cleared out nicely, except the vein didn't here. So when we have the soft tissues on either side that are filling in our echoes, that's often poor elevational resolution. Our sound beams exist in 3 planes. Okay, we have our axial resolution, we have our lateral resolution, and then here we have that slice thickness, or elevational resolution. Right, so my transducer's here. This sound beam has 3 dimensions. So elevational is one that's kind of built in, right? Axial is that SPL divided by 2. Lateral is how narrow we get that sound beam, or our focal zone. Okay? In general, in more details go into all of this that you're going to learn about, right? Lots and lots and lots. Okay, so that sound beam, we can resolve things if we can fit this sound beam between those 2 things. If we are looking at lateral resolution, if my sound beam is this wide, I can resolve 2 things on either side of it. My image will have 2 little things there. If, however, the things exist super close together and they're within the space of that sound beam, it's going to look like one thing on my image. They're not resolved. We have to fit our sound beam in between 2 things. So let's pretend Like I want to resolve this remote, this little Logitech remote here. Let's pretend like this is my sound beam, right? Because I could print my image on a piece of paper. Our sound beam should be basically like a piece of paper. I need to be able to fit it between the two objects. So this way, between these two remotes, has to be thin, slice thickness. That would be our elevational resolution. Now if my sound beam's coming this way and I need to resolve it between these two things, I need to put a tight waist on that sound beam and pull it in tight so that side by side, that lateral resolution can fit between that mouse and that remote so it can resolve each one. Now if I want to resolve this remote from this blue block here, I have to have a short little pulse, right? A tiny short little, I'm going to shrink this guy down, SPI divided by 2, little pulse to fit between these two things here in order to resolve them, okay? All right, in physics, in ultrasound, and in most of life, something happens, there'll be a consequence, right? And often a trade-off, and we need balance, right? So as you're studying physics, ask yourself 3 main things. If this, then what? And what happens? So, if then, cause and effect. If I increase my frequency, then what happens? And as you answer, then what happens, answer what are the good things that happen and what are the bad things that happen, because there's going to probably be a trade-off. And then ask yourself, why? If I increase the frequency, then what happens? Well, I get better resolution and poor penetration. Why? Why does resolution increase, get better, if I increase frequency? And why does penetration get worse? What happens? What happens with absorption? All right, back to this screen, our whole image screen. There's a lot of information over here. Again, it tells you transducer, the preset. This is your mechanical index, your soft tissue thermal index. This is about bioeffects. You'll learn about that. There we go. This is your frame rate. This is all B mode. This is saying I'm using harmonics. If I turn off harmonics, then it says it's B mode. And it changed a lot. It highlighted everything that would change. If then, here's frequency, gain, speckle reduction, the frame average, the color maps that I'm using, the depth that I'm scanning to in centimeters, the dynamic range, and acoustic output power. If I turn on color flow, now it tells me all that information about the color. There's some different things there, right? And then if I add pulse wave, so this is duplex scanning. This is scanning with all 3 modalities at once. This is kind of what it looks like. I showed you with the carotid what that looks like. It has all this information about each one of those modalities, okay? If I'm doing all 3, if I'm scanning in that with all with B mode, color flow, and pulse wave, my frame rate just dropped down to 7. Whereas if I'm just scanning B mode, I was up to 19. If I turned off harmonics, my frame rate is at 38. So my temporal resolution will be faster. And it's going to be a lot slower and glitchier if I'm scanning with all these things on it. Okay, so that's something to keep in mind if you're wanting to scan with this live or with this set. There's if-then, there's consequences for what we do, and we need to know what those are and which we want to do, what we're willing to sacrifice for what at the time, and how to best optimize not just the images, but our scanning as well. Because if you're really struggling to get something that you need to get, a particular image or a velocity, and you're not finding it, you're not getting it because you're trying to make your machine work too hard, well, we can try something different so it doesn't have to work so hard. All right. Let's see about scanning with 3D and 4D. All right, here we are scanning in 4D. There's a little baby face, and we're in real time. And a little nose. But as I scan, well, there's a cord. See how glitchy that looks? Now, just as the sound beam is three-dimensional, and we can scan three-dimensional images and scan in 4D, right? But even just as the sound beam is three-dimensional, right, our transducers are also three-dimensional. And how they are made affects the structure of the sound beam, okay? So you can think about that and think about the structure and function of the transducers and how the way that they're built affects the resolutions, the 3 or 4, right, resolutions. So, for example, we have side to side, and then we have this height here. All right, it's kind of difficult. Okay, we have this height here on this transducer, okay? And if you think about how that sound beam is going to come out, which of the resolutions is that going to affect? This way to this way, that sound beam is going to be how it's narrowed in the side by side, right? That's going to be your lateral resolution. This height here on that faceplate, the more height, the more that it can narrow together, and the better the slice thickness, that elevational. Right, here comes my sound beam coming out of my transducer. So we have that slice thickness of the sound beam, the lateral resolution, and then that axial resolution going to be how that sound beam that just fell to the floor pulses out from here going away, right? And I'm holding this transducer as well because if you look at the height of these faces, which one has better elevational resolution? Which one can you do 3D with? Right, so when you're talking about the resolutions, you can also think about the shape and the structure and the function of the transducer itself. So you'll have the best elevational resolution if you have like a 1.5D or 2D array transducer.